don't want to be heroes. We don't want to be heroes. I just want to be an ordinary doctor.
A person who chooses that profession because they have some desire somewhere in them to help other people.
No one wants to be doing this job right now because it's complicated, and as I said, although we do it without complaints or anything, we are a bit scared.
Nos sentimos medio atemorizados por lo que
Actually very, very heartwarming to see how many people have come to help. People are adopting dogs, people are fostering dogs, literally more than I've ever seen in the 25 years I've been in animal rescue.
Carers are heroes too, and I said thank you.
The coronavirus pandemic is the biggest outbreak in living memory. It has threatened global health and livelihoods on an unparalleled scale. But the battle against COVID-19 also saw unlikely heroes step up. Countless ordinary people demonstrated courage and compassion in extraordinary ways. While those like doctors and nurses stood at the front lines in the fight against a deadly virus, others pitched in by going above and beyond the call of duty. As we look at the year gone by, we dedicate this special show to those who served humanity in times of an unprecedented crisis. They may not wear capes, but they are superheroes of the pandemic. The real heroes of 2020. Confronted with the new virus they did not understand, healthcare workers across the world are risking their lives to save their patients and stem the spread of coronavirus. A shortage of personal protective equipment, especially in the early weeks of the pandemic, left them dangerously ill-equipped. But caught between disease and death, leaving family and loved ones behind, these brave warriors in white coats often waged a lonely war. After grueling shifts treating coronavirus patients, Hong Kong doctor Alfred Wong often finds himself alone in his hotel room, separated from his pregnant wife.
We detach ourselves from the rest of the world. So I don't go home after work. I don't eat. I try not to eat inside restaurants. I try to do takeaways.
Like many others, he cut his hair really short to reduce any gaps in protective clothing. The 38-year-old volunteered to join staff on isolation wards, dubbed the Dirty Team, to avoid the risk of being called up later and missing his daughter's birth. But he does not think of himself as a hero.
We don't want to be heroes. We don't want to be heroes. I just want to be an ordinary doctor. I want this to die down very soon. I want this thing to end very soon. And I want us to return to our daily normal routine.
The Steinbocks, a Brazilian couple, are trying to find a balance.
Tá bom. Oi. Eu vou acender as velas.
Dr. Fabienne Steinbock is an infectious disease specialist at one of the main coronavirus hospitals in Sao Paulo, Brazil, while her husband, Dr. Jacques Steinbock, is the head of intensive care at the same hospital. They say the stress of being on the front line of the pandemic often wakes them up in the middle of the night. Neither of them is getting much sleep these days. They constantly worry about their children, who are left alone at home while they work long hours at the hospital.
Our family relationships have changed because we are both on the front line, and we always have this anxiety, this worry about what is going on when we go home, what we might bring back home. There is this worry that did not exist before. There is a worry about the children.
And who can forget the heroic Dr. Li Wenliang? The Chinese whistleblower worked as an ophthalmologist at the Wuhan Central Hospital. He was trying to sound an alarm about the deadly contagion, but was arrested by Chinese authorities for spreading rumors. Dr. Li contracted the virus and subsequently lost his life to it. Li's death from the virus prompted a global outpouring of grief as well as anger at China's attempt to silence him. From collecting equipment to bagging up swabs and blood samples to answering the phone as well as looking after patients, this nurse has been multitasking for most of 2020. Meet Martha Navarro, an ICU nurse manager at the Los Angeles County USC Medical Center. She says there are days when she feels completely drained out.
Good days where you come in, things are going okay, no patients die on my shift. But when they do, it's extremely difficult because a lot of times we are human beings and we can take that personal. Not necessarily personal, but we feel like, where did we go wrong? And sometimes you take those situations home, and it's difficult when you don't have somebody to talk to about what's going on, and you hold on to that.
Because families cannot be at a dying patient's bedside the world over, nurses have been called on to be the conduits for video calls, to provide emotional support. As months go by, this has begun to take a toll.
The most difficult thing for me is when you have to turn the families away. Families are very important and essential for the healing of the patients, and when they cannot see their loved ones, and I have to be the one that says, I'm sorry, you can't come to see your loved one, that makes it very, very difficult for me.
Not only are doctors and nurses putting their own health on the line to treat their patients, many of them are also being forced to make another devastating sacrifice: distancing from their own families to keep the virus from infecting their loved ones. This is Hong Yeon-hee, a South Korean frontline worker. This 33-year-old nurse spent months away from her 4-year-old daughter while treating patients inside the country's coronavirus epicenter in Daegu.
The number of confirmed patients was increasing every day, and we had no idea when this was going to end. I had trouble sleeping. I was missing my daughter every day. One night, I just couldn't sleep. I was just looking at the pictures and videos of my daughter, and I found myself crying.
When she finally got to see her child, Hong Yeon-hee wanted to hug her, but could not.
It felt helpless. I missed my daughter. I wanted to hug her and be there for her, but I couldn't because I'm a nurse. It was upsetting because that was heartbreaking for me.
Frontline workers around the world have been exposed to COVID-19 at a high rate. None more so than paramedics, who are often the first point of contact for patients who have coronavirus.
The number of people's calls has grown. We drive more kilometers, we take long drives. Of course, it is hard to work in protective suits and we have to wear them regularly.
Living in Russia's Novgorod region, Larissa Debelo has been working hard to keep up with the number of rising COVID-19 cases. They begin their day by sanitizing and wiping down everything in their ambulance, and then wait for the calls to start. Paramedics like her are the difference between life and death. Healthcare workers who were risking their lives every day to save people from the virus were celebrated the world over. Not so much the hospital cleaners, a less visible category of frontline staff. These workers also risk infection and death, but receive far fewer accolades. 60-year-old cleaner Evelia de la Cruz was assigned to the COVID-19 ward in a Chicago hospital in March. An immigrant from the southern coast of Mexico, de la Cruz was tasked with stripping sheets and sanitizing beds.
Seeing a sick person and not being able to help is very painful. If my hands could cure these people, I would. It hurts me so much not being able to help them. But yes, I can. Being there, serving them, cleaning their rooms, being there with presence and seeing them suffer is very painful.
Some of de la Cruz's colleagues refused to work the COVID-19 wards, leaving the hospital understaffed. She has been laboring 7 days a week, at times for weeks on end.
I feel good working at the hospital. I'm happy knowing that I'm serving the sick. I know I'm doing something good and that fills me with pride. Knowing that I'm doing something good for the sick, for the hospital and for the country. I've already had COVID and in spite of that I stayed. I don't regret anything.
Since the outbreak began, the only time de la Cruz took time off was in July, when she herself was infected with the virus. After a month-long recovery, she cheerily returned to disinfecting the coronavirus-contaminated areas of the hospital. Meanwhile, in Italy, where thousands have died due to COVID-19, these workers brought comfort to those recovering from the virus.
Non facciamo solo le pulizie qua dentro, noi doniamo un sorriso.
We don't just do the cleaning here. Since doctors and nurses are very busy, we give patients a smile and a word of comfort. We also try to help them this way. Patients feel confused without their family clothes. Some didn't even know where they were.
Certi non sapevano neanche dove erano.
Be it hospitals or public transport, offices or homes, cleaning and disinfecting have become a major part of our everyday life. As countries emerged from coronavirus lockdowns, a proper sanitation of transport systems was needed. This meant disinfecting buses, taxis, trains and planes. In Paris, the public transport operator, RATP, uses the nebulization method to disinfect its buses against possible traces of COVID-19.
Right now, we are carrying out disinfection operations through a process called nebulization, which produces a disinfectant mist. This operation allows this mist to be dispersed throughout the structure of the bus, so as to protect all the surfaces and stands inside the bus.
In the French city of Rennes, an army of cleaners get to work on the night shift, cleaning the city's underground trains. They use a virus-killing cleaning agent to help curb the spread of COVID-19.
We constantly try to clean up. Afterwards, there is a personal responsibility of the passengers. It's good to get into the trains with gel. It's good to get out also by sanitizing one's hands.
more than 1.7 million people have lost their lives due to coronavirus. And the world is running out of burial space.
The rate at which dead bodies are arriving, we are running out of burial space for COVID victims. We will need new space by the end of this month.
In coronavirus hotspots, some families face a wait of several weeks before funerals can take place. The risk of COVID-19 spreading at gatherings and services means that funerals are becoming dramatically changed. Authorities at funeral parlors and crematoriums say they have seen their work multiplied with the surging number of COVID-19 deaths. The gravediggers have a job which is both emotionally and physically exhausting. In virus-stricken Chile, gravediggers at the Santiago General Cemetery have been put to the test by the pandemic.
No one wants to be doing this job right now because it's complicated. And as I said, although we do it without complaints or anything, we are a bit scared.
In Philippines too, the pandemic has upended the intimate ritual of laying the dead to rest. Virus restrictions often mean families are forbidden a last look at their loved ones before the body is consigned to the flames. Workers have to gently explain the regulations to distraught relatives. It is a painful and disorienting process for both the families and crematory workers.
We are really very careful. Sometimes family members want to have the cadaver bags opened, but under our protocol, we can't do it. Because once the odor wafts in the air, that's where you can be infected with the virus.
Managing the mourners and disposing of dead bodies has overwhelmed the workers, physically, emotionally, and physiologically too. These brave men and women are among the frontline workers pitching in despite the risk to themselves and their families. In March this year, almost the entire world was put into lockdown to curb the spread of the coronavirus. While most of the population was stuck at home, some were out on the streets, catering to the needs of those in quarantine. This included police personnel, grocery store owners, and delivery people. During a pandemic, strict maintenance of public order is essential. And for police departments worldwide, COVID-19 created a range of unforeseen and unprecedented challenges. In Qatar, police handed out protective masks during a road patrol to spread awareness. Meanwhile, in Panama City, the police danced and performed to entertain the capital's residents who were isolating in their homes. Traffic police in India's southern city of Bengaluru too danced and donned helmets shaped like the coronavirus as part of a street play performance to get motorists to stay indoors. Videos of such gestures have gone viral on social media. They can begin to look gimmicky, but remember, these videos don't reveal the full story. The police had to think of innovative ways of dealing with new challenges in maintaining law and order. The past few months showed people from all walks of life display immense courage and fortitude. From the paper boy delivering the newspaper at your doorstep, to the journalist and camera person reporting from pandemic-hit areas, there are many unsung heroes. Unlike most sectors, online shopping witnessed a boom during the coronavirus pandemic, and delivery executives of e-commerce firms were kept busy ensuring essential commodities reached their customers. They didn't deal with parcels alone. They also had to adapt to a new reality. They had to learn how to practice contactless deliveries and ensure proper hygiene. Narrating his side of the story is this United States Postal Service carrier, Oscar Osorio.
The volume these days is very, increased because of the coronavirus. People are at home and they're ordering stuff online. They depend on this. The volume has picked up dramatically.
Overloaded with work for the last 9 months, Oscar has been taking all the necessary precautions to make his customers feel safe. Perhaps the most important workforce after healthcare workers during the novel coronavirus pandemic were the grocery store employees. While some e-commerce players struggled to deliver essential commodities due to the lockdowns, people turned to their local convenience stores or mom-and-pop stores. In the wake of the pandemic, sales of household items such as groceries, cleaning supplies and toiletries saw a huge spike. And store workers put in long hours to ensure shelves were stocked and customers didn't return empty-handed. In April, volunteers came forward to deliver groceries in Italy's city of Naples. Solidarity food baskets became a norm as the pandemic struck the country, wiping out an entire generation. During the same month, volunteers with 3D printers responded to a shortage in an Athens hospital. A group of 3D printing enthusiasts, professionals and amateurs produced hundreds of protective face visors to reduce the demand-supply gap. People also stepped up to help animals in need. While some fed stray animals, others gave shelter animals a forever home. In South Africa, a dedicated staff at an animal shelter went into lockdown with dozens of dogs, cats and horses to make sure their four-legged residents are not left to fend for themselves during the coronavirus crisis.
Dedication and passion for, love for the animals. That's why we're here and dedicated our time to do this.
Many new inventions were inspired by the pandemic. In Kenya, students responded to the outbreak by building a mechanical ventilator. In France, engineers joined forces to invent a low-cost open-source ventilator known as Mac Air. Two Lebanese brothers manufactured a pod dedicated to testing COVID-19 suspects without exposing medical staff to the virus.
We made the coronavirus testing pod, the goal of which was to protect the medical crews as a priority, health work. Secondly, it helps save protective gear that is becoming hard to find. It also speeds up testing and can be used by all hospitals, all health centers, and could even be used at the airport.
These stories show us that the coronavirus crisis was a strong driver of creativity and innovation. The pandemic has changed the world as we know it, but ultimately the human spirit will prevail. Heroes are defined not by their rank in society, but by their actions. And COVID-19 is a reminder of the power of hope and solidarity.
WION is now available in your country. Download the app now and get all the news on the move.